Well, hello and welcome to everybody joining us here today. I'm Fiona Lang-Sharp, IBCLC Director of Communications and one of the MCs here at Gold Learning. Today, I am very excited. We're talking about our tongue tie conference coming up. And let me tell you, you're in for a treat. So many great presentations. And we also have some add-on packages as part of the conference this year. And today we're sitting down with Dr. Ruiz-Guzman, who is here with us, who's going to be part of one of our add-on packages. Welcome back, Dr. Lewis. It's so good to have you here today. Thank you so much for being part of our tongue tie conference.
Thank you.
You're very welcome.
Beautiful invitation. Thank you. And it's important, this thing.
Yes.
We are here for this reason.
We're very excited, of course, to have you. And I have had a chance to sit and even listen to your presentation already, which I have to say is amazing visually. I'm a visual learner. And when I watched your presentation and I listened, it just connected so well for me. Having more and more pictures and videos really helps practitioners learn more. So that when we go and see clients, of course, we feel better because we have more skills. We have seen this before, even if we haven't seen it in practice. So absolutely fabulous. Some of the things that you spoke about in the presentation, I want to talk a little bit about right now. And so one of the questions I have for you is, tell me a little, you have a conversation during the presentation about ankyloglossia versus tight lingual. Tell me a little bit about why you started to use this language and how you started to describe the difference to practitioners. So tell me about this.
Okay. Tongue tie is a rest of embryological mucosa that has not disappeared at the 20 weeks of gestation. It must be disappeared to all. Ankyloglossia is the lack of movement of the tongue, because could be a tongue tie, could be fibrosis of the mucosa of the mouth, could be another different situation that produces ankyloglossia. Not all tongue ties are ankyloglossia, and as well as not all ankyloglossia are tongue tie. There are different classifications, there are different point of view, there are different medical aspects, and I will propose that you choose one of these tools, Hasselbacher tools, Test da Linguinha from Brazil, or BETAT tool, and use this tool in order to make a diagnosis of ankyloglossia, that these tools are useful. Don't say, my opinion is that the heart is flat. My God, no, some information, we have some information that the heart is rounded, is a sphere. Well, tongue tie is not an opinion. It's not. It's a diagnosis done by this tool of Hasselbacher, by this tool of Corillos, or the presentation of this tool of these other two people from Brazil, Martinelli and Ingram from England. We have to change. Some years ago, when I was the coordinator of Baby Friendly Hospital Initiative in Spain, I used to teach breastfeeding to all these different courses I prepared and I did, and I used to say, tongue tie doesn't affect breastfeeding. My God, this was a thing that we have to change. Tongue tie, when you have ankyloglossia, affects breastfeeding, and is one of the responsible, like Michael Walrich said in the paper some years ago, more than 50% of the problems of the breastfeeding is, well, this is that I know. There are some babies that breastfeed with tongue tie. Of course, there are some people who make an accident from 10 flats and it survive. But this is an exception in general. Sure. When you have tongue tie, you have the possibility to go very bad.
Yeah. Well, thank you so much. I appreciate that, because I think that people have very strong opinions about, diagnosing tongue tie. And sometimes I think we need to step back and really, assess whether it is in fact impacting, whether it is a type, lingual phrenolom, or if it is in fact ankyloglossia. So that's the good news. And then the other item you talked about was all the assessment tools. You mentioned a few just now. So if and there are many new tools I find on the market right now, very visual with pictures. I think many of us are familiar with Dr. Hazelbaker's, the ATLIF assessment tool. But tell me, maybe if I was new to the field, is there something that you would tell me that I should use? Or even if I've been here for some time, maybe I should stop using an older tool, go to a newer tool. What advice would you give to me about the tools today? What should I use?
I said in my presentation that you have to use the tool that you are friendly with the tool. Read all papers of the Hasselbacher, read the paper of Guedes, the Martinelli, it's in English. You can read all of them. And well, we need research. Choose to do 2 or 3 of them and test in all of them and say later on that this method is more useful for you. I did this times ago. And
right.
Again, I choose Hazelbacher because I know her. And it's that I have been using the last 15 years. For me, is the more useful because I know how to do it. And because with this system, I can teach the fathers what means the tongue tie. Is the father with the gloves that touch the baby and could answer me, this is soft, this is hard, this is not soft. I can show the father and the mother, obviously, to the family, taking the tongue up. Where is the end of the tongue tie in the tongue? And where is the tongue tie in the base of the mouth? Well, this is very easy to this is that one. With the other one, you can do it the same. This English one, you have a picture of them and you can say to the father, what is that? And the father itself, or the mother itself, she herself, could make the diagnosis. And having this diagnosis, and there is a lot of information in this moment that after cutting the tongue tie is going perfect for the breastfeeding the baby, if the cut has been well done. One of the things that I have not talked sometimes is that now in my consultation and in the hospital, we are looking a lot of babies that has been cut in the tongue tie, but has been cutting only the first part of the tongue tie, the very thin part of the tie. When you have to cut the thick part of the tongue tie, the part that, well, is not possible, like not giving permission to move the tongue.
Right.
The very thick, well, you can move. It was cut some years ago by the midwives, by the SNILE. There is a publication that it was cut very, very easy. It was cut in the last century, at the start of the last century. Well, we have to do now the good intervention in order to have good results of the tongue tie section.
Yeah,
absolutely. And the diagnosis, choose the tool that you are friendly with her.
Yeah, so I hear you. I respect that so much. I think that, growing up in this field where, it used to be very limited tools, and so you didn't really have a choice. But now there are definitely more. So you can definitely look at all those tools. But I think you're right. You have to read the research that goes with it and understand what you're looking at in order to be effective in choosing a tool as well. And I know that you talk more about this during your presentation, so everybody will need to come back and listen to your whole presentation to learn more.
Perfect.
To learn more, which is great. Well, lastly, before I let you go, I want to talk about the long-term outcomes. because when I'm in practice or if I'm talking to colleagues, Louis, sometimes they will say to me, well, we don't need, why are we doing this? We're doing too much, or how do we know it's going to be helpful? So how do we justify this to colleagues or very importantly to our families? Because if they are struggling, but maybe they don't want to do the intervention and they say, well, tell me, how is this really going to improve? What do we know long term? So tell me about what you say.
You have to use in your consultation with every family different way. For instance, if the baby is a girl and has a tongue tie, a very clear ankylosing, I looked at the father, and I say, Daddy, you have tongue tie. He said, me? I never heard this before. And he said, listen, it's a chromosomic thing that you have tongue tie. And I explained to the father, did you take some problems with the teeth? Yes. Did you have kyphosis? Yes, I had back problem all the time. Did you have to go to the long therapies when you were young? Yes. Did you have problems of eating some pills? Yes. Well, with this, he said, your baby has tongue tie. You have had tongue tie. Later on, there is a system to make the diagnosis of tongue tie in adults by Irene Marquesan, a Brazilian therapist. That you can use this system. I test the father, and when the father knows there is a tongue tie, I was not talking about breastfeeding to the father. And I say to the father, your mother tried to breastfeed you at 15 days, she has not more milk. She have a lot of, yes, my mother said it was not possible to breastfeed me. This is a history in a lot of people who has, this history of family.
Yes.
If she's a girl, if the baby is a girl, if this is a man, look, I'm looking to the mother, and I asked the same questions to the mother, and the mother said, yes, I had to put some teeth correction. I have a bad position of the tongue. I couldn't be presented, work on the TV because I couldn't speak very well. I have, and in this moment, he said, all the babies of this woman who has tongue tie could have tongue tie in the time. And I said, this is one of the reasons that could help the family to decide to cut tongue tie in the correct way, well done, and making exercise the rehabilitation later on. And the other thing that you asking me is to the colleagues. To the colleagues, I will say all the time, show me that it's not necessary. I have to show you that it's necessary to cut tongue tie. Please show me that it's not necessary. Never has been done before. This is the problem of some people of 30, 35 years, 40 years, that the tongue tie was not cut, and they have had problems of snoring, with apneas of the night. It's a lot of problems of tongue tie. Well, this is important thing that to my colleagues, did you make any research against breastfeeding? Please do it. You could be combined that it's important.
That is amazing. I so highly respect that. I can imagine I've had those conversations, Louis, with the father. And I think it just blew his mind. We talked about the migraines, the lower back pain. He was off work at the time because of this chronic illness that they didn't really have a diagnosis for. And I recommended that he go talk to his dentist and his, someone that was tongue tie friendly and, and to have a look. Yeah.
These dentists didn't know nothing about breastfeeding in some cases. There are more of them. There are a big group of them that now are working on breastfeeding. But it's not a problem of the baby. The baby has no teeth. But when the first teeth become out and they are rotted inside, this is when we have to say, cut it, don't die, and breastfeed the baby better. This is a thing that we have to continue making this advocacy slowly, explaining this data. There is a lot of papers. In the webpage, I said, I don't say nothing without a paper before.
Right.
A paper published. Doctors has to read these papers
Yeah.
and look that they are not published in any, well, in the Friends of Tontai. No, this is a paper published in British Medical Journal. There is a Lancet, the same that the Lancet did with breastfeeding. We have to do something like this, but it's time.
Yes, absolutely. Well, thank you so much, Luis. Just always so good to chat with you. And we could talk all day about this topic for sure. But really appreciate all your wisdom, your knowledge and your understanding and your passion for this area of work. And it is one family at a time for sure. But we really appreciate you being here. And we'll look forward, of course, listening to the full presentation. So thank you again. And to everybody who's listening in right now, please head over to goldtonguetie.com and you'll be able to register for the entire event. We're very excited about our Gold Tongue Tie online conference and we can't wait to see you all there. Thank you again for joining me here today. Have a wonderful rest of your day. Bye-bye, everyone.